Today we will study diabetes mellitus, commonly referred to as DM. It is often called sugar disease in everyday language. In this lecture, we will cover the definition of diabetes, the signs and symptoms of diabetes, the mechanism of diabetes, how it occurs and what causes it, the types of diabetes, the treatment of diabetes, and finally, how to prevent diabetes. Let's begin with the definition of diabetes. What is diabetes? Everything we eat enters our stomach, then moves to the intestines and is absorbed into our blood capillaries. Imagine this: whatever we eat is digested in our stomach, then absorbed into the blood where it is converted into glucose. This glucose circulates through the blood and reaches our cells, providing energy. Here you can see some cells on the side. These cells need glucose to function. In the blood capillaries, the white dots represent glucose and the blue dots represent insulin. For glucose to enter the cells, insulin is necessary. Here, in a healthy body, you can see insulin attaching to the cell's receptors, allowing glucose to enter. However, if insulin is absent, glucose cannot enter the cell. It stays outside the cell, unused. In this case, we say the person has diabetes. Signs and symptoms of diabetes. Now let's look at the signs and symptoms of diabetes. Increased thirst. A person with diabetes feels extremely thirsty. Frequent urination because they drink more water. They need to urinate more often. Extreme hunger despite eating. They feel constantly hungry. Unexplained weight loss. Their weight decreases without any clear reason. Fatigue. They feel tired and lack energy. Irritability. They become easily irritated or annoyed. If someone has these signs and symptoms, it indicates they might have diabetes. The mechanism of diabetes. Let's now understand the mechanism of diabetes. Everything we eat eventually gets converted into glucose and enters the bloodstream. The body stores extra glucose in muscles and the liver for future use. Our brain constantly requires glucose, but we cannot eat continuously to supply it. When glucose levels drop, the body signals the pancreas to release insulin. What does insulin do? Insulin converts glucose into glycogen and stores it in muscles and the liver. If glucose levels become too low, the pancreas releases another hormone called glucagon. Glucagon converts stored glycogen back into glucose, which then enters the bloodstream to be used by the body. This balance between insulin and glucagon keeps blood glucose levels normal. In diabetes, this mechanism gets disrupted. Types of diabetes. Diabetes has two main types, such as type 1 and type 2. We will explain both. Type 1 diabetes. It is also called as insulin-dependent diabetes. In type 1, the pancreas does not produce insulin because the pancreatic cells are destroyed. Without insulin, glucose cannot enter the cells, causing high blood glucose levels. This condition is called insulin-dependent diabetes because external insulin is required. Type 2 diabetes. It is also called as insulin-independent diabetes. In type 2, insulin is produced, but the insulin receptors on the cells stop working. Glucose stays in the blood, unable to enter the cells, resulting in high blood sugar levels. This type is called insulin-independent diabetes. because the issue is with receptor sensitivity, not insulin production. Treatment of diabetes. Let's talk about the treatment for each type. For type 1 diabetes, since insulin is not produced, we give insulin injections to normalize blood glucose levels. For type 2 diabetes, we use medications like metformin to improve insulin receptor sensitivity, which helps reduce blood sugar levels. Prevention of diabetes. Now, let's discuss prevention. Eat healthy foods like fruits and vegetables, and avoid spicy or junk foods like burgers and pizza. Exercise daily to maintain a healthy weight. For those who are obese, losing weight can significantly reduce the risk of diabetes. By making these lifestyle changes, we can lower the chances of developing diabetes. Question of the day. What is the hormone lacking or ineffective in diabetes? Only a genius can answer in the comments below. If you would like to watch my other lectures on topics like the lungs, kidneys, liver, brain and eyes, visit my channel to view my other videos.